When we talk about conflicts in the Middle East, most headlines focus on geopolitics, security, or global oil prices. But there is another consequence that rarely makes the news, and that is the disruption of life saving medicines. In a new piece I wrote for the Lancet Oncology, I explore how ongoing tensions in the region, including those connected to the United States-Israel alliance, could affect global pharmaceutical supply chains, including cancer drugs. To better understand the human impact, I spoke with several experts, including Professor Mark Lawler, who is a professor of digital health and chair in translational cancer genomics at Queen's University in Belfast. One of the most striking points he made is this: when conflict hits, cancer systems can quickly collapse, hospitals come under pressure, patients are displaced, supply chains break down. And suddenly, people who were receiving treatments such as chemotherapy, radiotherapy, or even pain medication can no longer access it. Drugs stop arriving, appointments are missed, diagnosis is delayed. For cancer patients, even short interruptions in treatment can have devastating consequences. What we have seen in places like Ukraine is that disruption in supply chains can ripple across borders. Patients flee to neighboring countries, health systems become overwhelmed, and fragile cancer care systems are pushed to the brink. The same pattern are already being observed in conflict zones such as Gaza Strip, where access to cancer diagnosis, treatment, and medicines has been severely affected. One key issue Professor Lola highlighted during our discussion is drug supply. Cancer treatment depends on highly coordinated global supply chains. When those routes are disrupted by war, sanctions, damaged infrastructure, or political tensions, the consequences can spread far beyond the immediate conflict zones. Even a brief interruption can mean patients receive partial treatment, delayed treatment, or no treatment at all. And this problem is especially severe in low and middle income countries, where health systems already operate with very limited buffers. Another important lesson from recent conflict is the need for preparedness. Professor Lola argues that government and international organizations need to start treating this as a predictable reality and not a rare crisis. That means building resilient cancer systems, strengthening international cooperation, and even considering measures such as strategic drug stockpiles and joint procurement systems. It also means collecting better data. Right now, in many conflict-affected regions, we simply don't have enough reliable information to fully understand how cancer care is being disrupted. And that lack of data makes it harder to respond effectively. Perhaps the most important message from our conversation is this: humanitarian responses are still largely designed for acute infectious disease outbreaks. But the global health landscape has changed. Cancer and other non-communicable diseases now account for a growing share of deaths worldwide. And yet, during crises, they often receive far less attention. As conflicts become more frequent and more complex, protecting continuity of care for chronic diseases like cancer will become an increasingly urgent global health challenge. In the full article, I explore how geopolitical tensions can ripple through global pharmaceutical supply chains and what that means for patients who rely on life-saving medicines. Because behind every supply chain disruption is a very real human story. A patient waiting for treatment, a misdiagnosis, or a life-saving drug that simply never arrives.